reports from the southern tip of South America indicate a significant public health crisis unfolding as Argentina faces its most severe hantavirus season in over a decade. In the 2025-2026 epidemiological cycle, the National Ministry of Health has documented a total of 101 confirmed cases, resulting in 32 deaths, a case fatality rate exceeding 31%. This surge has placed the city of Ushuaia, often referred to as the gateway to the Antarctic, under intense international scrutiny following the departure of a luxury cruise vessel that became the center of a deadly cluster. While hantavirus is endemic to various regions of Argentina, current data shows that case counts have remained consistently above the epidemic threshold throughout the early months of 2026. The situation has triggered a palpable shift in the local economy of Tierra del Fuego, where source reports describe tourists departing the region amid growing concerns over the viral spread. To understand the gravity of the situation, it is necessary to examine the underlying virology of the pathogen. Hantavirus pulmonary syndrome, or HPS, is a severe, sometimes fatal, respiratory disease caused by infection with hantaviruses. In the southern cone, the primary reservoir is the long-tailed pygmy rice rat, scientifically known as Oligorhizomes longicaudidus. These rodents carry the virus without showing signs of illness, shedding the pathogen in their saliva, urine, and feces. Transmission to humans typically occurs through the inhalation of aerosolized viral particles. This happens when rodent excreta is disturbed, often during the cleaning of long-disused cabins, sheds, or during outdoor activities in tall grass, causing microscopic droplets to become airborne and enter the human respiratory system. The current outbreak in Argentina is particularly concerning because of the high concentration of cases in the 20 to 49 age bracket, with a notable mortality rate among young adults. Public health officials indicate that the spike in cases is likely driven by a combination of environmental factors, including specific cycles of drought followed by heavy rainfall, which can lead to a surge in rodent populations as food sources like bamboo seeds become abundant. As the number of infections in 2026 alone has already reached 42, the focus remains on identifying the exact environmental triggers and the geographical extent of the current reach. For the residents and travelers in Ushuaia, the primary concern remains the rapid progression of the disease, which often begins with non-specific flu-like symptoms before evolving into a critical, life-threatening condition. Epidemiologists are closely monitoring the situation to determine if the current surge represents a seasonal peak or a more fundamental shift in the endemic nature of the virus within the region. The core of the current international alarm centers on the MV Hondius, an expedition cruise ship that departed from the port of Ushuaia on April 1, 2026. What began as a routine journey across the South Atlantic, with stops in Antarctica and South Georgia, quickly transformed into a medical emergency at sea. According to the World Health Organization and the Africa Center for Disease Control, a cluster of severe acute respiratory illness was reported among the 147 passengers and crew on board. As of early May, 8 cases have been identified, including 3 fatalities. The timeline established by health investigators reveals that the index case, an adult male, began showing symptoms of fever and headache on April 6. By April 11, his condition deteriorated into acute respiratory distress, and he died while the ship was still in transit. Laboratory testing conducted by specialized facilities, including those in South Africa and the Netherlands, confirmed the presence of hantavirus through polymerase chain reaction, or PCR. Testing and subsequent genetic sequencing. The results confirmed that the patients were infected with the Andes virus, a specific strain of orthohantavirus native to South America. The identification of the Andes strain is a critical development for public health reporting, as it is the only known hantavirus capable of person-to-person transmission, usually requiring close and prolonged contact during the early stages of the illness. This complicates the surveillance efforts currently underway as health agencies in the United Kingdom, Cape Verde, and Argentina attempt to trace 34 passengers who had disembarked the vessel before the full extent of the outbreak was recognized. One passenger who had traveled as a close contact of the index case was medically evacuated from Ascension Island to Johannesburg, South Africa, where they remained in intensive care after testing positive. Clinical reports from these cases describe a rapid progression from gastrointestinal distress and fever to pneumonia and shock, often within a matter of days. While the Argentine Ministry of Health has officially stated that no cases have originated from within the local population of the Tierra del Fuego province itself, the departure of the infected passengers from Ushuaia has linked the city to the global response. The investigation now focuses on the activities of the passengers prior to boarding, with the current working hypothesis suggesting that the initial exposure occurred during land-based activities in mainland Argentina or neighboring regions where the virus is known to circulate. As the MV Hondius remains moored off the coast of Cabo Verde for medical evaluation, the international community is closely watching the data to see if the suspected human-to-human transmission is confirmed among the ship's crew and remaining passengers. In response to the escalating situation, public health guidance has been reinforced across Argentina and for travelers returning from the Andean region. Prevention remains the primary tool for containment, as there is currently no specific vaccine or antiviral cure for Hantavirus pulmonary syndrome. Officials advise a strict protocol for the wet cleaning of potentially infested areas, using a solution of 10% bleach to soak surfaces before cleaning to prevent the virus from becoming airborne. The use of high-efficiency particulate air, or HEPA, masks is recommended for those working in rural environments or cleaning enclosed spaces where rodent activity is evident. Despite these clear medical guidelines, the response to the 2026 outbreak has been complicated by a significant geopolitical shift. In March 2026, Argentina formally withdrew from the World Health Organization, a move that has led to a diplomatic firestorm. The Argentine Ministry of Health has accused international bodies of politicizing the cruise ship outbreak to influence sovereign decisions, while maintaining that their domestic preventive epidemiological monitoring is fully active and capable. This friction highlights the honest limits of current knowledge. Without seamless international data sharing, the speed of contact tracing and the monitoring of the Andes strain's transmission dynamics may be hindered. Epidemiologists note that much remains unknown regarding why this specific season has seen such a dramatic rise in cases, though they point to habitat destruction and shifting endemic areas caused by climate change as likely contributors. For the public, the message from health clinics remains one of cautious vigilance rather than panic. While the tabloid framing of the situation suggests a state of terror, medical professionals emphasize that hantavirus infections remain rare for the average person who avoids direct exposure to rodent habitats. The focus for travelers should be on awareness of symptoms, specifically the sudden onset of fever and shortness of breath following travel to rural South America, and seeking immediate medical attention if these occur. As the 2025-2026 season continues, the primary goal for surveillance teams is to prevent the spillover of the Andes strain into urban centers and to manage the current cluster with rigorous isolation and testing. The situation in Ushuaia serves as a reminder of the complex intersections between wildlife reservoirs, human mobility, and global health security in an era of environmental change. Stay informed on the latest health developments by subscribing to our updates on global public health reporting. The core of the current international alarm centers on the MV Hondius, an expedition cruise ship that departed from the port of Ushuaia on April 1, 2026, marking the beginning of a complex multinational health investigation. What was scheduled as a routine journey across the South Atlantic, with planned stops in Antarctica and South Georgia, quickly transformed into a medical emergency at sea, as a cluster of severe respiratory illnesses emerged among the 147 passengers and crew on board. According to recent updates from the World Health Organization and the Africa Centers for Disease Control, the cluster has now resulted in 8 confirmed cases, including 3 fatalities. The timeline established by epidemiologists reveals that the index case, an adult male, first reported non-specific symptoms, including fever and headache, on April 6. By April 11, his condition progressed rapidly to acute respiratory distress, and he succumbed to the illness while the vessel was still in transit. This death triggered immediate shipboard isolation protocols, but not before several other passengers had begun showing similar clinical signs of infection. Laboratory confirmation has played a pivotal role in identifying the specific threat. Samples were initially analyzed at specialized facilities in the Netherlands and South Africa, where polymerase chain reaction, or PCR, testing confirmed the presence of Hantavirus. Subsequent genetic sequencing identified the pathogen as the Andes virus, a specific strain of orthohantavirus native to South America. The identification of the Andes strain is a critical development for public health reporting and international travel logistics. Unlike most hantaviruses found in North America or Europe, which are transmitted solely through rodent-to-human contact, the Andes virus has a documented capacity for person-to-person transmission. This transmission usually occurs during the early prodromal stage of the illness among those in close, prolonged contact, such as family members or individuals sharing confined living quarters. On a cruise ship, where passengers share common dining areas and ventilation systems, the potential for a secondary wave of infection is a primary concern for maritime health authorities. The logistical challenge of managing this outbreak is compounded by the fact that 34 passengers had already disembarked the MV Hondius at various NTS before the full scope of the cluster was recognized. Health agencies in the United Kingdom, Cape Verde, and Argentina are currently engaged in an intensive contact tracing effort to locate these individuals and monitor them for symptoms. One traveler, identified as a close contact of the index case, was medically evacuated from Ascension Island to a high containment unit in Johannesburg, South Africa. This patient remains in critical condition in intensive care, serving as a focal point for clinical data on the progression of the 2026 strain. Medical reports from the Johannesburg facility describe a rapid clinical decline, moving from gastrointestinal distress and high fever to severe pulmonary edema and cardiogenic shock within a matter of days. These symptoms are characteristic of Hantavirus pulmonary syndrome, where the virus causes the capillaries in the lungs to leak fluid, effectively drowning the patient from within, while the international community focuses on the ship. The situation on the Argentine mainland presents a conflicting narrative. The Argentine Ministry of Health has officially stated that no new cases have originated from within the local population of the Tierra del Fuego province itself, despite the city of Ushuaia being the point of departure. This discrepancy has led to tension between national authorities and international observers. In March 2026, Argentina formally announced its withdrawal from the World Health Organization, a move that has significantly impacted the flow of real-time epidemiological data. Argentine officials have accused international bodies of exaggerating the risks to the tourism sector, while maintaining that their own preventive epidemiological monitoring is sufficient. However, without full participation in the international health regulations framework, the speed at which lab results and travel manifests are shared has slowed, creating gaps in the global surveillance net. As the MV Hondius remains moored off the coast of Cabo Verde for continued medical evaluation and quarantine, the investigation continues to look for the original source of the infection, focusing on whether the index case was exposed during land-based excursions in rural Argentina prior to boarding the vessel. As the 2026 hantavirus season continues to challenge public health infrastructure across the Southern Cone, the focus of the response has shifted toward aggressive prevention, community surveillance, and managing the logistical fallout of the outbreak. The primary defense against hantavirus pulmonary syndrome remains the interruption of the transmission cycle between rodent reservoirs and human hosts. Health officials in Argentina and neighboring regions have reinforced standard mitigation protocols, particularly for those living in or visiting rural areas, where the long-tailed pygmy rice rat is prevalent. The core of this guidance is the wet cleaning method. Because the virus is transmitted through aerosolized particles from dried rodent excreta, activities like sweeping or vacuuming in infested areas are strictly discouraged. as they can launch viral particles into the air. Instead, the public is advised to saturate any potentially contaminated surfaces with a 10% bleach solution, 1 part bleach to 9 parts water, and allow it to sit for at least 30 minutes before wiping. This chemical deactivation is essential for neutralizing the pathogen. Furthermore, health clinics emphasize the importance of ventilation, opening doors and windows for at least 30 minutes before entering long-closed buildings, such as cabins, sheds, or storage units, can significantly reduce the concentration of airborne pathogens. For workers in high-risk occupations, such as forestry or rural construction, the use of N95 or HEPA-filtered respirators is no longer a suggestion but a critical safety requirement. The limits of current medical knowledge, however, present a significant hurdle for clinicians. There is currently no specific vaccine or antiviral therapy approved for the treatment of Hantavirus pulmonary syndrome. Clinical management is limited to supportive care, typically involving mechanical ventilation and hemodynamic stabilization in an intensive care environment. The high case fatality rate observed in the 2025-2026 cycle, exceeding 31%, underscores the necessity of early intervention. Public health guidance identifies the prodromal phase as the most critical window for medical consultation. This initial stage involves flu-like symptoms, including high fever, severe muscle aches, particularly in the large muscle groups of the thighs and back, and gastrointestinal distress. If these symptoms appear following travel to endemic regions or potential exposure to rodents, immediate reporting to a healthcare facility is required. The challenge for surveillance teams is that these symptoms are nonspecific, often leading to misdiagnosis during the early, most treatable stages of the illness. The ethical and geopolitical dimensions of the 2026 outbreak add a layer of complexity to the global response. Argentina's formal withdrawal from the World Health Organization in March 2026 has created a documented friction in international epidemiological reporting. While the Argentine Ministry of Health maintains that its domestic monitoring is robust, the lack of integrated data sharing with the global community complicates the tracking of the Andes strain, which remains unique for its potential for person-to-person transmission. This lack of transparency has led to a climate of uncertainty, contributing to the terror described in some reports and the subsequent flight of tourists from Ushuaia. Ethically, public health editors face the challenge of balancing the need for urgent warnings with the prevention of unnecessary panic that can devastate local economies. The goal of reporting is to provide a grounded, evidence-based assessment of risk. While the virus is severe, it remains a rare event for those who follow established safety protocols. Looking forward, the scientific community is investigating why the 2026 surge has been so pronounced. Theories focus on masting events, where a sudden abundance of food, such as bamboo seeds, leads to a population explosion among rodents. Climate change and shifting rainfall patterns in the Patagonia region are also being analyzed as potential drivers that force rodent populations into closer proximity with human settlements. Until these environmental factors are fully understood, the message from health agencies remains one of cautious vigilance. The tragedy of the lives lost in 2026 serves as a stark reminder of the persistent threat posed by zoonotic diseases and the critical need for coordinated international surveillance. For ongoing coverage of emerging health threats and global medical updates, consider subscribing to this channel for factual, wire service reporting.